Okay, so we're going to be differentiating between transverse orientation or technique. Some people use the word orientation or technique for these. And then we're going to demonstrate vertical technique. We're going to demonstrate all three stroke directions for both techniques. So if I'm holding my insert and it's vertical, like a curette, like a 1-2, this would be our transverse orientation or technique. And what I'm going to be doing here is I'm going to demonstrate a horizontal stroke with this technique. So we can always hit calculus with the tip. So I'm holding my handle, but I'm going in a horizontal direction. I can come up and whack the calculus with the face. Now I'm doing a vertical stroke using the transverse orientation. And then I can go just sort of oblique by pivoting on my hand. Now, if I needed to get subgingivally a little bit more, I'm going to transfer into the vertical orientation or technique. Now my handle is parallel to the occlusal plane. Now my insert working end looks like a probe.
I'm
So
zooming out here so they can see your handle. There we go.
we often call this like a probe or probe technique. So I'm on that same tooth. I'm going to insert it. I can go vertical stroke direction. I can go horizontal stroke direction. I can go oblique. Oblique stroke is just pivoting once again like a hand instrument. You're going to be always keeping a lateral side to the tooth. You don't really want to take the face to an interproximal surface at all. You can hit calculus with the face. If I were to slip in here and there was I can come back and hit it with the face or hit it with the tip. As long as you have a lateral side adapted to the tooth, you don't have to worry about that tip hitting the tooth. We never do this.
So I do want to just interject here because I have told a couple students about using the face on anterior teeth, but we do not want to teach that here because you are beginners. So we're not going to do that. We're just going to use our transverse horizontal or our transverse vertical interproximally, or your lateral orientation. Go ahead to your lateral.
I don't know what you mean.
Your vertical orientation,
Yeah,
sorry.
vertical orientation is going to be like a probe, so
sorry.
the handle drops.
Yeah.
But the stroke
So
directions
that's
are the
what we can
same.
use.
You can go
Correct.
a vertical stroke direction, horizontal stroke direction, or oblique stroke direction.
Yep,
Now, I'm going to show you with a right and left.
that's it.
So if I have a slimline L in my hand, how I remember this, and we have little cheat cards that you can use as a guide, but I use it this way. If I've got the L in my hand, I'll go to the lower left, and it's going to be buccal lingual, which also equates to surfaces away for a right-handed, and then it's going to go buccal lingual. That's how you would use the L, and then you would have to accommodate for anterior teeth. What I want to show you here is you're only supposed to be using the vertical orientation with right and lefts. Your handle, we should never see your handle up like this. So if I was going to be doing this distal and I insert this and I walk back, I have to tilt it to get underneath. I can go vertical stroke direction, I can go horizontal, so on and so forth. But as I come across that facial aspect, my hand must move across the face. So my hand is on the left side of the face, but as I move across and come mesially, my hand is on the right side of the face.
And that's why having that extra oral fulcrum is so handy, is that you can literally just move and glide across their face as you're instrumenting with these lefts and rights.
So that's one thing you cannot do. Don't get hung up on a fulcrum when you're ultrasonic. You must, extraoral works really, really well. And sometimes even cross arch can sometimes work really well. You know, if I was here and I was going after calculus that was, now this is the P1000, I can go a vertical technique. I can go ahead and rotate that up into the oblique orientation. You see that? So oftentimes you are going after that calculus that's more supra in the oblique orientation. So I can come up and I can whack that calculus and I say, gee, I feel a little bit down here. I'm going to switch into my vertical technique and I can get subgingival. So I tend to think of oblique orientation more supra. I think of vertical orientation for sub, in a nutshell.
Yep,
All three stroke
Agreed.
directions, either one.
agreed. All right, if you have any questions, please feel free to ask me, Miss Entinger, or Miss Koch. Oh yeah, hi guys.